Beautiful today. It was in the 80s. We've had very strange weather over the last week or two. It's been raining, it's been cold. Today's 80s. This weekend it's going to be raining all weekend. So, and we're in Manhattan and it's beautiful. It's New York City. And what could be bad?
And the blooms are luscious.
So in New Mexico, we say no complaining when it's raining because we're a desert. So whenever we get even a little rain, we're so grateful.
So we are actually on 23rd Street in sort of Chelsea in Manhattan, as you know. But for those of you who are tuning in, it can be a very noisy street at some moments because we have the thoroughfare to the east side. The hospital's on the east side. So every once in a while there'll be a siren or a fire truck. And it's unavoidable. It's what we have.
It's part of our life.
It's part of our life here in Manhattan. And
in New York, we say always complaining, always complaining.
Always complaining, always complaining. Why is it raining? So Mayar, introduce yourself.
Sure. Hi, everybody. My name is Mayar Hasid. I'm the online programs manager for the New York Zen Center for Contemplative Care. I'm also assistant to the teachers, the guiding teachers here. I wanted to welcome everyone to our evening tonight. Our conversation tonight is called Contemplative Medicine Conversations, Prescriptions for Alleviating Suffering. And tonight we're joined by the guiding teachers of the New York Zen Center. We have Sensei Koshin Paley Ellison, and we have Sensei Chodo Robert Campbell. We're also welcome Tieraona Low Dog. We have Tieraona Low Dog here. She's an MD and an internationally renowned physician, author, educator, and thought leader in integrative medicine. So this evening, we're going to be discussing the birth of our new fellowship, the Contemplative Medicine Fellowship, and how contemplative practice can be a powerful instrument. Be a bunch of other things discussed, and we're going to save questions. We're going to have a session for questions at the end. Please use the Q&A button at the bottom. I'll be monitoring these, and then I'll be sharing it with the teachers towards the end of our session together. So let's kick it off. Koshin, Chodo, Tieraona, welcome. Can we just begin with discussing perhaps a bit about why we're here, how are we here, discussing and exploring contemplative medicine?
Good question, Mayor. How about the answer, Koshin?
Well, I think we're here because all of us have understand suffering in our own lives. And we know what it is to struggle and to have pain and difficulty, and have each of us, I think, have used that experience in our own lives so that we can learn how to serve the world, because I think we share a common passion for healing and what it means to show up and to serve without needing to fix. And so many years ago, Chodo and myself, were giving a keynote talk for an integrative medicine conference. And we had the joy of this amazing woman coming up and saying, "Hello, and will you come and teach, and can we learn together?" And that was tea. And it was an amazing beginning of many years of knowing and loving each other and having an incredible journey of what does it mean to show up for clinicians, and how do we show up for ourselves, and really seeing how those are one thing. How we show up for ourselves is how we show up for other people. So that really the giving and receiving are one thing. And so I feel that my understanding of why we're here is that we love serving and being of use to this world. And it couldn't be more clear during this time that the world needs more contemplative medicine. So we're here to bring what we can to be a part of the healing of this time.
Tieraona.
Well, just so it's just everything you said is just so important. You know, it doesn't matter what type of practitioner you are. You were drawn to help alleviate suffering because of something that was deep inside of you, which started you on your journey to become a nurse or a chiropractor or a physician or a psychologist. Whatever drew you to that was because there was a sense that you wanted to be of service and that you wanted to help others. And I think that what we've come to really know is that that we see a lot of suffering, and that it's not just individual suffering or even self-suffering, it's collective suffering. And there's been a lot of this that has sort of risen around the world, but in this country too. So the pandemic was a part of it, but also a collective suffering around aggression or racism or intolerance. All of these things are a collective type of suffering. And I realized very early on in my own practice was that it's very hard to focus on the health of an individual if you don't also focus on the health of their family. And it's hard to think about healthy families if you don't think about healthy communities. And it's hard to think about healthy communities if you don't think about a healthy world. And so we each step in where we can, but as somebody who trained in family medicine, that was sort of my underpinning, was that it was, how do we alleviate suffering by recognizing it and giving it a name and not ignoring it and talking about it. And that's something that I think a lot of clinicians, at least in my own medical training, there wasn't much space for that. There wasn't much space given to talk about how do we hold that? How do we hold that suffering when we are sitting with someone? And how do we hold our own suffering when, you know, you're called to the bedside and you're running a code and the person dies? And it's like, well, fill out the paperwork and then go on to the next patient. There wasn't this space for really getting at how do we hold that? And I think that many clinicians, as we're seeing from the people that are applying to the fellowship, they're hungry for that. They're looking for, how do I help heal myself so that I can be of healing to others? And how can I do that in an environment that nurtures my soul and my spirit, as well as my mind and my body? So we are going to pursue knowledge, and we're going to pursue compassion and being present. But this whole fellowship, the whole idea of it is really around, how do we bring people together that are looking to journey in the same direction so that you're not alone. And I'll tell you, from running the fellowship, 2 fellowships now, one at the University of Arizona and one for the Academy of Integrative Health and Medicine, is that fellowship itself is very healing, because you're bringing people together. I can't tell you how many clinicians would say to me, I always felt like I was the oddball. I felt like there was nobody to talk to. I felt like I was the only person that thought like this. And now I'm with other people and I realize I'm not alone, that I have other people, brothers and sisters, that are on this journey too. And that gives me a lot of hope, and it gives me a lot of comfort and a lot of security. So I am thrilled. I'm the third musketeer here. So when Koshin and Chodo told me they were going to do this, I was like, how can I serve? Like, how can I serve? Because you two are just amazing healers. You do such amazing healing, and you bring such love and compassion into the world. I was happy just to, to be on the back end or do whatever you needed me to do. But I'm thrilled that I'm thrilled that I get to be here and learn with you and beside you, and hopefully help to give clinicians what they need and what they're looking for, so that they don't leave, so they don't stop what they're doing, caring for people, because there's a lot of burnout right now. And that's part of my heart, is that if we can help people feel more present in this moment, and open that compassion that is so deep in every clinician that I know. that people won't have to leave. They'll be able to stay and help care for people. So I'm just thrilled to be here. Chodo.
Chodo, that's me.
Exactly.
Well, first of all, I have to say, when Koshin and I were thinking about this, for now it's 2 or 3 years to launch this initiative, this program, the first thing we thought, one of the first things we thought was Tieraona. We have to drag Tieraona into it, and it wasn't even a drag. It was like we just have to bring Tieraona into it. And to hear you say, you're happy to serve on the back end was great, but that wasn't enough for us. We wanted you to be really in the trenches with us. You would say yes. But, you being so modest, I'll just be on the back end. We're like, no, Tieraona, you're up here with us. This is a really, really exciting moment for us in our careers, in our life, in our work, just on our journey. You mentioned something about doctors coming into the room and someone's coded, and they're there when the person dies, they fill out the paperwork and go on to the next patient. In my only role as a chaplain, as a priest, and as a contemplative care educator, there's one story that sticks with me and will always be with me. I was taking care of I was working with, giving spiritual, in a spiritual capacity, should we say, as a priest, to this very, very devout Roman Catholic family, husband and wife. Actually, and that's not even important, other than to say, I got very, very close to them as a Buddhist monk with 2 very devout Catholics. And there was something very, very beautiful, something very symbiotic about our relationship. They were Italian, actually. And the day that Aurelio died, he had sent his wife over home the night before to freshen up. He knew he was going to die. The morning that he died, I was with him, and the nurses came in, and he had started to hemorrhage. So the nurses came in, got him into the bed, and the doctor came in, and he died within moments, within minutes. He died. The doctor came in, did the thing, checked his pulse, said he's gone. Note the time, and then he started to walk away. And I said, "Where are you going?" He said, "What?" I said, "Where are you going?" He said, "I've signed the paper. I've signed the notice. I have to go to the next patient." I said, "No. You have to respect what's happening in this room right now. This person has died. In my role as a priest, as a chaplain, we say a prayer." He's like, "I don't know anything about prayer." And I said, "Well, I'm a Buddhist, they're Catholic. Let's do the best we can." And so I had myself holding the dead person's hands, the nurses, and I had the doctors hold the nurses' hands. And I prayed. And the nurses gave some words. And I promise you the doctor was crying. And so I have never, ever witnessed this, and I will never be the same again. I will make sure I stay in it. I will not run out of the dead person. I will not run out of the dead person.
Chodo, it's a little hard to hear you. If you could speak a little louder into the microphone.
I always get this problem. Did you hear me?
Speak up.
Did you hear what I said, Mayor?
Yes, we were hearing it. It was just a little low.
Okay, so for me, that was a turning point in my career as a contemplative care educator. I said, you know what? More doctors need to be. It's almost like giving permission to take the moment. You do have permission to stop, to witness, to bear witness to what has just happened. Because in that moment, when you're bearing witness and you're taking that on, this actually happened. Don't run out of the door. Take a breath. What am I feeling right now? Deep sadness or deep respect or deep whatever it is, but honor the person that you have just signed the death certificate for. Please just do that. And that's kind of where we started this journey. Like we need to be able to work with, to allow doctors to soften, to allow clinicians to be fully present to themselves and to others. Yeah.
Yes. I was just starting my internship at the University of New Mexico, family medicine intern. And my first couple of months were on surgery. And because there was no anesthesiology residence that year, we had to cover the trauma surgical intensive care unit. So, down there, first night, not really sure what I'm doing, right? I was a medical student 4 weeks before, and now I'm a doctor. I'm an intern. There was a gentleman there. His name was Nestor. And when I came on, he was not conscious. He was very large, very bloated. He'd been in there for a couple of weeks. He'd been in a bad car accident. And I'm presenting on rounds in the morning, and I said Mr., and I said his last name. And my chief resident was just like, oh, for God's sake, just the patient, in the room, right? And I said, okay, kind of new to this, and presented the case. The next day I went back. Nestor still wasn't awake. This went on for about a week. And then the chief resident said, we're having neurology come down. We're going to see if he's brain dead. And neurology came and said, yes, that we needed to go ahead and go through the process of notifying the family, and we needed to turn off life support. So since I was family medicine and not surgery, they said, well, why don't you get in touch with the family, explain what's going on and everything. So I said, okay. So I found his wife had been deceased. He had 2 sons. So we arranged I explained what was going on. They arranged to fly in because they didn't live in New Mexico anymore. And when I was speaking to them, I said, and if there's anything of your father's you'd like to bring, if he loved a certain kind of music, anything like that, please just bring whatever you would like to bring. So they came, and I arranged to be there, which none of, I was like, who's going to be there? And everybody was like, you. So I was like, okay. Again, kind of new to all of this. And the nurses were so wonderful, and they were so generous in helping me. And so I met the 2 sons, and the first thing I just said to them is like, I'm so sorry this is happening. And I said, I'd love to give you just a little time with your father. Do you have any questions for me? They didn't. They wanted to have a little time with their father, and I came back in. I told them to just let me know. Came to the door and asked me to come back in, and they said, we're ready. The nurse had already told me that she was going to tell them that she was going to turn off any of the buzzers or anything, so nothing would go off as he passed. But as we were there, I said to them, I said, I only know your father from caring for him, but I never got to know him as a person. I just wondered if you could tell me anything about your father. I said, I just would like to know something about him. And they began to share where he lived and where they grew up in northern New Mexico, and that he loved Spanish guitar music, and that he loved to go fishing, and that people just loved him, and he was a wonderful father and a great husband. And I just felt this outpouring of just this sharing for this man that I'd never got to know. And the nurse asked if we were ready. They said yes. And so everybody seemed very tense. And so I had noticed one of the boys was wearing a St. Francis around his neck. And I asked if they would like to pray, if they would want to pray. And they did. So we all held hands and we prayed. And a few minutes later, we looked over, and the boys went over, and the father had passed because he couldn't survive without life support. And they were just alone with him. I asked if they wanted to be left alone. Did they want me? It was this most beautiful experience. And a few days later, I'm there rounding, and there's a big thing of flowers. And the nurse came over who'd been a part of it. And she said, I can guess who these are from. And I said, oh, those are for me. And she said, yes, Dr. Low Dog. And I read the card. I still have the card, actually. I kept the card. But it was this really beautiful expression of thanking me for making what was such a painful experience less painful. And the nurse said, it never really happens like that here. We never have music. We never, that just doesn't happen here. And I looked at her and I said, why? Why wouldn't it happen like this? And she said, honey, I don't know. I gave her the flowers, and I've never forgotten Esther, because he was one of my first teachers as a physician about keeping soft and keeping my heart soft and being present and just showing up was a lot of it. So I resonate with that story, Chodo. I also recognize that it was the nurses who helped me, because none of the physicians, it was just kind of, we're back to business, right? We're just kind of back to business. So that when you talk about giving space, creating space, that's a lot of what contemplative practice has meant for me, to give me space, that time to sort of be present without reacting. It gives me that space to do that. Gosh, if we could help with that, even in a small way, that would be a very good thing for a life well lived for me as a teacher. That would be beautiful.
So beautiful. I'm just reminded too of, a number of years ago, maybe 4 years ago, when we went to a healthcare system to do a resilience training that was based on the Four Noble Truths. And it was with a group of attending physicians over a series of weeks. And it was looking at suffering and the end of suffering and freedom. And it was really poignant. There were very seasoned attending physicians, and there were some residents and some fellows and a whole range of folks, and who were learning about, wait a second, we need to do things differently, don't we? And because we all kind of know that it's broken, and the easy thing in some ways and the painful and heartbreaking thing is just to stay with the way things are. Mm-hmm. And what we brought together was really these circles, as Albert Einstein says, to widen out our circles of compassion is our work. And so we did that. And so much of it was really about paying attention. And remember, there was this one OBGYN physician, and she was long-term meditator, but never had figured out how to bring these things together. Like, what is that, her daily practice, and how did that inform how she functioned with the people on her team, with her patients. And I remember her saying, the first class, I think it was, where she said, I don't think I've looked one of my patients in the eye in 20 years. And I realized that so much of where she said, it's almost like I've been gutted inside, because I don't even feel my own humanity. And she said, and I realized when that was, which I never knew until now, which was that I had to tell a mother and a father really difficult news.
Like they just got in his Perrier.
You still hear me?
Yes, yes.
That she had to tell them difficult news, and she was never prepared to tell them that. And so she said that was the beginning of her looking away. And so for me, the poignancy of the practice of contemplative medicine is really about bringing those things together, like, how do we sit in the awkward, uncomfortable spaces with courage? And it was amazing to see her coming back class after class and just feel like, wow. She's like, I started looking at my patients the second week And she said, I have started to come home feeling energy returning
Yes.
slowly.
Yeah.
But I feel like, and she said, I feel like my humanity is returning. And so I feel like in many ways, that's also why we're here. How do we do that and bring more of that forward?
And the reality of it is, this is nothing new. We're not reinventing a wheel here. You know, this is something we all know how to do. We've just forgotten. You know, it's like this. It's compassion. It's love for others. It's like relationship. How do I relate to another human being? How do I bear witness to the suffering of another human being? How do I bear witness to the joy of another human being, of a woman giving birth to a baby? The other side, the other end of that, you know, that same, a mother dying, you know, it's like that, the continuum. How do we just hold everything that's important, that's dear, that's real? You know, this is not, as I said, this is not reinventing the wheel. You already know how to do this. You already know how to take care of someone, how to be fully present to another. For many of you, it's just, you've forgotten it. It was kind of beaten out of, you know, out of you in med school. No, you don't have time for that. This, blah, 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 blah. There's no, you know, there's no, it's not, keep your distance, keep that veil, keep that wall between you, that clear wall between you. Don't get too involved with your patients, because you're going to burn out. You know, you can't get too close to your patient, you're going to burn out. Guess what? It's the opposite, you know?
It's true.
The
Yes.
more empathic that we are, the more easily, the more able we are to deal with the heartbreak, you know? I mean,
Express the compassion.
to express that compassion. Wow.
Yeah.
I can't imagine what you're feeling right now. I can't imagine what you're going through. Oh, this is so awful right now. Rather than, well, we're going to do the best that we can. I'm going to send the social worker in right now, or I'm going to send the priest in right now, the chaplain, and I make an exit, quick exit. It's not about that, you know.
Yeah.
You know how to do this. You just have to be willing to retry, to engage your life in a different way.
Well, clinicians, you know, for the sick, for a lot of people, I mean, we know this. We know this in our own lives too, that when people get sick, sometimes friends stop coming by as much. Family's not quite sure how to interact. And I always had this image that that healers lean in. Instead of backing away, we sort of lean in. We lean into it. It's what we're drawn to do. We want to lean in. We want to share. We want you to know you're not alone. And I resonated with something that you said, Koshin, that I've said a lot to residents and fellows over the years, is that can you be with someone without having to fix them? Because some things can't be fixed, right? And that's where this whole notion of pain and suffering really kind of meets, isn't it? You know, that one can actually live with pain and not suffer. And some people have really not much pain, but suffer greatly. How do we enter into that? You all you spend much of your life working with those as they're dying, people that are leaving this world. Talk to us about that. Just talk to us about what that is and what draws you to midwife people through that part of their journey.
Well, first of all, I'd like to say it's one of the most profound things I've ever done in my life. I honor each and every person and each and every time that I'm with someone who's dying. It's something that I never, ever could have imagined I would be doing with my life. And I had a calling, you know.
How did you come to it?
How did I come to it? It's one of those stories that movies are made of, you know. It's from a childhood of terrific abuse, a lot of abuse, and taking care of it as a caregiver at a very early age, 9, 10, 11, taking care of an alcoholic mother, then journeying on my own road of alcoholism and drug addiction, and until I found my Buddhist path with my teacher, who may be online this evening, almost 3 decades ago now. And I realized after maybe a year of meditation practice that a part of me had died during my years of addiction. There's something in me that was dead. There's this closed downness, this not wanting to be vulnerable, not wanting to be with people who are vulnerable. It's like pushing it away. And I stepped into, through a Buddhist teacher, I stepped into volunteering in hospice. And it was almost, it sounds kind of crazy, I got it, but it was like, oh, this is where your life will come back to you in this work, being with people as they're dying. So for me, my story is, I know what death is like, because on some level I've experienced it. And it doesn't have to be dark. It doesn't have to be around shutting down. It can be about seeing things as they really are. And as I said, honoring that and being with. And one of the first questions I will ask to someone who is dying is, what do you fear most about death? What do you fear most? Because that's what I had to ask myself. That's what I had to ask myself when I was in my years of recovery. Chodo, what do you feel most about dying? It's like, I've already done that. I need to see it differently. And it's a beautiful, beautiful, beautiful honor that I have. And to see, and for those of you who work in hospice, you know how special it is. You know how incredibly profound and heartbreaking and moving, enjoyable it can be. And I just want to say at this point, I have met the most beautiful, the most caring, the most bearing witnessable doctors in the world. You know, there's no way that I'm saying or believe that no doctor has time, no doctor has compassion, because I've met some really beautiful, beautiful clinicians, physicians. So just want to make sure that that gets out there to you all. That you're doing great work no matter what. You know, we're in a system that gives you 3 minutes to visit a patient, boom, boom, boom. And actually in 3 minutes, you can do a hell of a lot. You know, even
You
just
can.
by holding a patient's hand. How are you doing? You know, boom, that's all it takes. You know, so
just being completely present. That's the whole thing. It's like not bringing what just happened with the next patient in the other room or the lab results. It's that I used to, when I'd wash my hands between patients, that would be almost the ritual of washing away whatever was sort of there that was not just about the person I was going in to see. And it was very therapeutic, I think, actually, because when you're seeing 20 people in a day, it's a lot of energy and it's a lot of stories and it's a lot of things happening. And if you're just completely present with somebody, just completely present, in 15 minutes, you can get a lot done. This was when I was with the integrative medicine down at the U of A. I would say, you know, everybody's like, I need an hour and a half. I need 2 hours for the visits and everything. And I'm like, well, I've mostly just been in primary care and I don't have that much time. I said, but I actually feel like if you are just really, really present for that 15 minutes, a lot can happen. A lot can get done. But I think a lot of times we're not present. We're not present when our children are talking to us. We're not present when our partner is talking to us. We're sort of, our mind is in lots of different places. And an hour won't be enough time if you're scattered like that. So But I agree. I have somebody made a comment once to me about people who were not integrative clinicians and blah, 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 blah. And I said, you know, there was a doctor at UNM Hospital who was the most gruff surgeon, just the meanest fella. And one night I was there and I was rounding on all the patients before I was going to go try to catch a little bit of sleep. And I looked in, and there was that trauma surgeon reading the Bible to a 78-year-old woman who I had been called to prescribe Haldol for, an antipsychotic, because she was sundowning, becoming more confused as the evening went along. And he was there after being up since 5 o'clock in the morning. And here it was like 9:30 at night. He's still in the hospital and he's reading her Psalms. And I thought, integrative medicine isn't a set of tools that you learn. It's the way in which you view the world.
Mhm.
It's the way in which you practice. It's who you are. And that man, if you would have said he was an integrative or he was anything, he just would have snapped your head off, because that was kind of old trauma surgeon he was. And I saw in that moment, I saw a most blessed soul. And it's just, you find it in the strangest places sometimes. But I do think that most clinicians, the ones that I know and I've met, their hearts are big, their hearts are open.
Okay.
And they just need this kind of fellowship to help remind them of why they came in, and help as they go through this journey of reconnecting with that healer inside of them. And I'm excited.
I wanted just to, you were talking about how most of what we do, is working with people who I always think that some of the time we spend time with people who know that they're dying. And most of the time we're spending with people who don't know that they're dying, which is all of us. And I often think of the lessons of the dying are, what did I do with my life? And I think that one of the things in this that I'm excited about is in the fellowship is like really developing fellowship around not having a split life. I hear in Chodo and I'm sure you hear again and again, like, oh, my life-work balance is off. I'm really bad at my self-care. We hear that around the country and in Japan when we teach there. And, also this thing like, oh, I'm just giving and giving. And so for what I'm excited about is also about how do we really come together and realize we have one life, and how we are at home, how we build home, how we build community in our life, and how we build community in our practice. And that really, in some ways, that there's not really self-care, there's only care, because how we, as we were talking about in the very beginning, how we care for this, is how we are going to be with others. So the more we're nurtured is the care that we'll give. And I think it's kind of breaking apart that dualism that, do yourself, go home and do your self-care, get a mani-pedi or do it. Like all those things could be great. But it's about how do you just have one life so that we can serve with one life, right?
I just want to, while you were speaking, when Koshin and I first came to one of your fellowship weekends, we were kind of hesitant, it's like, okay, you're going to have 80 doctors in a room, and because I've had this experience in hospitals in New York, we got to present to the hospitals in New York, and they're writing, and they got there on their cell phones, and they're looking, and they're texting, and they're looking at every once in a while, and maybe somebody will put up, interrupt in a moment. Says, oh yeah, I don't agree with that. And so when we came down to, I think it was Arizona the first time, to see these doctors from actually all over the world. And we were presenting on end of life care that weekend or that week. And to talk to this room full of integrative medicine fellows who were actually opening up to not only the work that we do, but allowing each other to be vulnerable, to speak to each other. Probably the first time in their entire career of being doctors. And we have, this is not to scare you at all, but we had doctors, clinicians actually crying with each other because they finally were able to talk about the BS that they have to put up with and the pain and suffering they have to witness.
And have never released.
And not being able to process because, you know, I'm the doctor, I'm the caregiver, I'm the healer. I don't have to break down. I don't have to be vulnerable. I'm strong. And to see a room of 80 doctors, 80, 90 doctors, sometimes as many as 100, as a unit, trusting each other, caring for each other. And all we were doing is showing them a different way to be. More compassion. It's easy to say. But the word, and that's, you know, from that first weekend with you, Tieraona, that's when we were like, yeah.
And that's when we started to fall in love.
And that's when we fell in love again.
That was the beginning.
You guys had me at hello in New York. So I was like, who are these two individuals having us doing this? It was beautiful. It was beautiful. You know, but it is interesting. We had about not separating out your life. You know, you just kind of are who you are all the time, right? And you know, we have a lot of chickens out here. I live out in the forest. I live up in the mountains of northern New Mexico. I'm very remote. We're about 25 minutes from a Dollar General, but we're an hour from a grocery store. And life here has its own rhythm. And I went up the other day to let the chickens out because they're out all day. And one was on the ground and had clearly been being pecked. And I shoot everybody out, and then I went to pick her up and I saw that she was quite ill. So I examined her, and I'm not a vet, but she had an egg that had broken up inside of her. And so I was trying to help her, but she was not well. So Jim says, my husband, who's wonderful, he says, well, I can just take her, you know, and just put her out in the forest. And I said, no. I said, I want to make a little bed for her in the back of the coop and separate it so she can still see the other hens, so she doesn't feel like she's by herself, but she's comfortable, and give her some water and just rest. And I put a heat lamp in there. And I would just go sit up there with her and stroke her. And she lasted about 2 days. And when I think what Albert Einstein was talking about, expanding our circle of compassion, I think he meant all living creatures and all of life. And even in those moments, like just being with this chicken, a hen, but I've raised since she was born, was still this same sense of, you're not alone as you suffer. You're not alone. I'm here. I'll make it warm. I'll make you safe. And when you pass, I'll take care of your body. And this is what I mean. It's like, it's not a, you don't turn it off and on. It's just the way you are in the world, to ease something of wherever you find it. And, but I do think, you know, when we think of collective suffering, I do think that there's a lot. And I have great hope as people journey through like contemplative practice and contemplative care and contemplative medicine, that that we can begin to not say it doesn't exist, not feel like we have to fix everything, but to be honest about that we see it and that we're all a part of it, and that's part of human existence. And how can we extend that circle of compassion to everyone and to everything? Yeah. You knew I was going to give you a chicken story. Yeah. So
I was waiting for the bear, but you know.
My bear, yeah. Hercules.
Mayar's on the screen. What's going on, Mayar?
The chicken story got me excited, and I'm here to maybe ask some questions that people are sending to me. We've had some beautiful shares. People are really touched by your stories. One person mentioned that they do the same hand washing ritual that you do, Tieraona, in between patients to be fully receptive and self-empty. Yeah. Very powerful question from Elizabeth Haka. She asks, how do you respond to the thought that it is very difficult to reconcile one's humanity with the current state of our healthcare system, which emphasizes profit over care? Many of us struggle with this within the institutions which employ us.
That's the biggie. You know, that's
Yeah.
Again, you know, I mean, the simple answer to that to a very, very complicated question from our, as the work that we do as contemplative care educators, and Tieraona will have an answer too, is like, for us, and this is a very simplistic answer, and I realize it's a big question, but again, what we stress is, you know, you're in a job, you have a career that is so stress laden, so stress heavy. Take a moment to remember why you're here. Take a moment to look at the work that you're doing, and not so much about the system and everything that's being forced upon you to do. Stop. Take a moment. Take a breath. Remember why you're here. And as I said, I realize that's a very simplistic answer, but that's the work that we do to remind you. Yeah, we're working in a system that's broken. I don't have to be broken with it.
Right.
I can take care of me. Tieraona, what's your answer as a doctor when working?
Well, I do think it's challenging. Even just the electronic health records, I'm still, you know, you're typing as somebody's sharing. I mean, so there's a lot of things we're dancing with as clinicians. I personally believe when we talk about that collective suffering, part of that is greed. I mean, that's part of this whole human condition that we're a part of, and this attachment to things and greed and profit, all of those kinds of things create a certain level of suffering just in and of themselves. However, we don't lose our humanity. That is like an optical illusion. We are not. We're whole. We're whole, and every moment we're in with our patients, you know, I'm not thinking about the billable and is it a level 4 visit? I'm not thinking about I'm not thinking about those kinds of things. I am just there in that moment with that person. And in that moment, there is no healthcare system. There is no administration. There's nothing. In that moment, it's just me and this human being in space, in time. Moment to moment is like when I had my cancer, I realized that it's like you're just chasing from one moment to the next, right? And I used to do that until I realized to be present in this moment is literally just to be present in this moment. And the next minute will come, the next moment will come, and I'll be present for that. It is, it's hard to do because, you know, my husband came to pick me up one night and I was writing my notes, and then I would stay and enter them into the electronic health record at night. And Jim's like, so the whole purpose of the electronic health record is so you can do it while you're in with the patient, and then you can leave at 6 o'clock. And I'm like, but my fingernails make all this noise when I'm clicking on the computer, and it's really distracting, and it's like, it's a horrible thing, and I can't make eye contact because I'm not a great typist. I hired a scribe. I said, I'll pay for it out of my own money. I'll have somebody sit in there who can like type everything in so I can just be present with this person. So what I would say to you, Elizabeth, is the fact that you can ask the question about your humanity shows that it's alive and well inside of you. And that we have to get really creative within the systems that we work. And and just try to remain present in those moments, because the moment when you have to remember about the administration and your pay and all of that will come soon enough. But don't bring it in with you into the room. Yeah.
I think also,
I'm thinking there might be a lot of questions.
okay.
There's a number of questions.
Okay.
But thank you for that answer. That was beautiful. Michael Libertazzo says, I'm a critical incident and debriefing psychologist working in a hospital with over 500 COVID deaths this past year. I've experienced the nurses far more open to accessing their feelings regarding their experiences than the MDs. The docs are weathered and feel they have to keep going and be prepared for the next one. I now have the ear of the CMO and the CEO. Any suggestions on how I might present this offering and gain the doctor's participation?
T.
I don't know. I was thinking, you guys, this is what you do. This is what you do. But I would just echo that I do think nurses, as a profession, that nurses are so much the caregivers and doctors are sort of the expert. And that I think I think that's hard. And that I think that when you're just, there's this song my daughter sent me from Taylor Swift, and it was called Epiphany. No, I'm serious. And this one thing, it was about doctors and, basically holding hands through plastic and trying to get 20 minutes of relief in the middle of a night when people are dying. And she said, I heard this song, Mom, and I just thought of you. I thought you would love this song. And I'm listening to this song and I'm reminded how art and poetry and music, how these parts of our humanities really, really can express things. I think that if you have the ear of a CEO and a CMO, there is some data, and Koshin and Chodo have some data. We're going to be collecting data too from the fellowship on how helping clinicians become more resilient through this will make them more productive, will help the bottom line, will prevent burnout and loss and hiring, because every time you have to hire somebody new, it's very expensive. That is the language that actually a lot of administrators resonate with. And there are data out there to support everything I just said.
Mhm.
And that sometimes you have to speak that language. But I'd love to know what Koshin and Chodo would say. But
Yeah. First of all, such a great question. And I so appreciate that you have the ear of those folks. And that one of the reasons we're doing this fellowship is that we know that people are in trouble. We all know that, in particular, doctors, more than any other profession, are in serious trouble. They have higher rates of death by suicide. They have higher rates of drug and alcoholism. They are leaving the profession. They're feeling like they either have to choose ending their life or leaving the profession because they're not supported and they're not taught the basic skills of how to actually be with suffering. And so what we're passionate about is, how do we teach people and learn together? And how do these CMOs and CEOs realize that we have to invest in skilling people up in the basic human skills that will actually bring life? And as Chodo saying, that it also is like good for the bottom line. And it turns out being human and training people to be human is good for the bottom line.
Mhm.
Thank you
beautiful.
so much.
I think we have time for one more question. Usha S. asks, how is contemplative care relevant to my pediatric patients?
Mhm.
Oh my.
That's
it's probably best for them. Children are, they're already so imaginative, and they're already so so easy. You know, it's like doing guided imagery with a child is so much more fun and pleasurable than doing guided imagery with an adult. And being with children, and the same sort of thing about being present, being totally present with a child. And there's a lot around, you know, children's rights and children, looking at children actually much more as full human beings than sometimes we think. So God bless the pediatricians, and I mean that. God bless the people who care for our children. I feel that as we deepen our own understanding of contemplative care, that translates really easy to children. And as a family practice person, you know, takes care of kids, I don't see a difference there. Or with babies, you know, when I was a midwife, sometimes there'd be a hard birth, and I would bring somebody in that would do, a friend that did craniosacral work, and she'd come in with these like babies that were hours old and just very gently hold their sacrum in their head, just so gently, just sort of like just bringing them back into their bodies. And I realized from years and years and years ago that children really resonate with contemplative practice. They love it. It's not as, they haven't learned, especially the early ones before they've gone to school, they haven't learned to shut that part of themselves out. You know, they haven't learned that, they haven't suppressed it. So I would say that, and I have a lot of pediatricians who do contemplative medicine, contemplative care, and integrative medicine, and they're highly sought out because parents and children alike love them, love them. Yeah.
My first year of training, 20 years ago, I was on pediatric oncology. And there's one patient who I get a Christmas card every year from the mother of this girl. I'll call her Stephanie. And Stephanie was 4. She had leukemia. She wasn't going to pull through. And, you know, her mother and the mother's sister were there every single day, the whole day. And, you know, obviously, Mom was so bereft, just being there every day. And Stephanie would be in her little cot, and she'd be laughing and giggling, having fun. And Mom was like, "Okay, I can't believe this is happening to my daughter. I don't know what to do. And I would visit, you know, with basically originally it's to be with the parents. Go take care of the parents, you know, the mother and the sister and the father. Go see if you can help them through this. And one day I just walked in, there was Steffi in the cot, you know, and I said, "Where are you going, baby?" And she said, "I'm going away." And I said, "Tell me about that." And she said, "It's a secret. Mommy doesn't want to know." And I said, "I think Mommy does want to know. I think Mommy wants to be and hold your hand." And it was, I mean, that for me, that was about, again, not being afraid to open up and to go to, who knows, maybe another answer wouldn't have been out, it would not have opened in that direction. But the fact that Stephanie was like, "I'm going away." I mean, how many times do we get an answer, but we don't hear it?
Yeah.
You know, someone else may have said, "Oh, yeah, you're going home soon," or "Yeah, you're not going, blah, blah, blah. You're going to get better." But no, it's like, where are you going? And we had this beautiful, beautiful next few days, I think it was actually about 3 weeks until she passed, but it opened up Mom, it opened up Dad. The fear of losing her became a very different story. It became a reality, and it became a journey, a very different journey with Stephanie, you know, and ultimately she died 3 or 4 weeks later. But what a journey, and what a teaching for me. You know?
I love you. I just love you. I love you. I do. I love you. Bless you. Bless you. I love that story of Stephanie.
Yeah.
I love that story.
And
It's a secret.
as I said, every year I get a Christmas card, you know, and they've had 3 more children. It's, you know,
Now the kids are in college.
now the kids are in college, and yeah.
One last thing, and I would just say, is that to that question, like what we're looking to cultivate in contemplative medicine is actually beginner's mind. So pediatrics, geriatrics, urology, whatever it is, what really matters most, I think, is that we are fresh and we're actually there. We all know what it's like to be with someone who's actually where they are. And you can feel when someone is behind their eyes in a discursive busyness. And so the beauty of the practice, so whatever your field is, it's like, how do you bring the freshness and joy? And actually, it's much more fun. It's where joy comes from.
We have one more, or we're done?
I think we've gone past time. Thank you, all three of you, so much for this beautiful talk. And Chodo, especially that last piece about children. I literally, my nieces are here right now. She's opening the door. I was hoping she wouldn't, but she's peeking in right now. So made me appreciate her even more. For everybody who's asking, we have shared the link to our fellowship page on our website. It provides all the information about dates, our faculty. You can find out more there. You can learn how to apply there. And I'd like to leave a few more minutes for you all, you three, if you have any closing thoughts for the people who are with us tonight.
Oh, I do.
Yeah.
I'd like to finish with, if I can recall it, if I can bring it. It's by Rumi, a poem of Rumi's. My heart is so small, it's almost invisible. How can you place so much sorrow in there? Look, he answered, your eyes are even smaller and they behold the world. T.
Oh, no, that was it.
That was it for you.
That was perfect. You need to know when to make an exit. That was perfect.
All
Thank
right.
you, Mayor.
Thank you,
Thank you, everyone.
Thank you all, everyone.
Great to be together.
Have a beautiful evening. You will be receiving the recording tomorrow. Thank you.
Thank you.